The purpose of coming together tonight is to present some new information that we've got, some expanded services that we offer, but more importantly, it's an opportunity for y'all to ask questions. That's really the purpose of being here this evening. Okay, so very briefly, here is your Amarillo VA Healthcare System Leadership Team. You met Dr. Gonzalez. Another individual I'd like to introduce is Mr. Mark Riello, who's the Associate Director. He is located up in Amarillo, and his father is actually a retired Command Master Chief. Okay, some of the things that we want to present this evening, we have a slide on National Nutrition Month, women's health, and then we've got a slide on whole health that I think you'll all be interested in. So without further ado, I'm going to hand it over to Ansley.
So since March is National Nutrition Month, we wanted to provide some information about nutrition services through the clinic. We have a great team of registered dietitians, and we can provide individual appointments for you and help with a range of different things that you may be dealing with. So it could be diabetes and blood sugar, it could be heart health and blood pressure, it could be that you have a GI issue or kidney issue, but there's a ton of things that nutrition can help and impact with. And so if you are interested in meeting with a dietitian, we can absolutely do that. Another program we have is called MOVE, and MOVE is a national VA program, and it is geared towards helping veterans achieve and maintain a healthy weight. It's found on 3 different pillars. So we talk a lot about healthy eating, we talk about being active, and we talk about behavior change and goal setting. So setting small, simple goals that you can achieve in order to achieve a large, huge goal of achieving a healthy weight. And since it's National Nutrition Month, tomorrow we are having a Healthy Teaching Kitchen cooking demo. And that will be at 11:30 here at the clinic in room 132, right behind us. And one of our dietitians will be demonstrating 3 different recipes with some samples. So we'd love to see you all there.
Thanks, Ansley. Okay, now I'm going to turn it over to Kristen Fife, who's going to give a presentation on the Women's Health Program.
Hi, thank you all for coming out. Our Women's Veteran Health Program is a comprehensive health program for our women veterans. We have free family planning. We do all the preventative screening. We schedule your appointments for the women and then follow up if need be. We also have focus groups for different topics like menopause or just about anything you ever want to talk about. We coordinate with behavioral health, and we have community care coordinators that we work with to make sure that your care is, the continuity of care is there through the community and through your provider care.
Thank you, Kristen. Okay, now on to the next presenter, Dr. Brian Green will talk to you about whole health and some of the services that we offer here, because most of these services are fairly new here in Lubbock.
Well, first thing I want to say is good evening and Semper Fi all my Marines out here.
Hoorah!
Hoorah! So, whole health is a newer concept that we brought in, and what we want to try and do is change the way we're thinking about healthcare here. And one of the ways we want to do that is try and make this very centered on the veteran and the veteran's goals and the veteran's needs. So we're working towards you to actually meet your goals in healthcare, and you get to tell us what you actually want out of this. One of the things we've recently opened up is the chiropractic clinic here on site. And one of the things we're trying to do is to make sure that as we're looking at all the veterans' cases, all the veterans who've been receiving chiropractic care, we're making sure that the care that you've been receiving is up to the standards that we expect, that the results are there that we're looking for. And if it's not there, we want to make sure that we bring you in and get you the results that we expect to have for you. A few of the classes that we're going to be opening up soon in a couple of weeks is a self-massage class where we're going to teach you how to work on muscles, how to work on trigger points. We already have a therapeutic stretching and exercise class to teach you how to use your muscles properly, how to warm them up, cool them down, treat your body in a much better way and a safer way for you. Staffing-wise, we've got a brand new acupuncturist who's going to be starting with us in 2 weeks. So we have a new acupuncture clinic that's going to be opening up right here on site with 20 years of experience, not only an acupuncturist, but also a doctor of Chinese medicine. So we're going to bring a lot more offerings there. We're also developing an acupressure class. So we actually use some of the traditional teachings to teach you how to use pressure points to relieve pain, relieve muscle tension in other areas as well. So a lot of comprehensive offerings that we're going to be bringing out here in the next couple of weeks. Bear with us as we bring everybody in and try to get some evaluations done and make sure we have you on the right path for whole health.
Okay, many of y'all know that the PACT Act was signed back in 2022. Many of y'all may not know that March 5th, there was a PACT Act expansion. And the big difference between the original PACT Act and the PACT Act expansion that was signed, that went into law just about 3 weeks ago, is that now you don't have to prove that your ailment is from something that occurred overseas. It's now either overseas or at home. So if you feel like you were exposed to a toxin, nuclear weapons, Agent Orange, or other chemicals, if it was at home or abroad, you can now apply for PACT Act benefits. So that's a huge deal for the veterans. Okay, an event that we've got coming up that we're pretty excited about here on the Saturday, the 4th of May, here in Lubbock, at the Lubbock Memorial Civic Center and Civic Hall, is what we call a Welcome Home event. And it's to thank all the veterans who are out here today and their family members, to thank you for your service. So it's a great event. They're going to have, there's going to be an open ceremony, there's going to be family fun, there's going to be food, other activities. Being a veteran myself, what's most important is it's free, okay? I'll give you an update on some of the things that we're doing here with the Lubbock Clinic. Some of the possible expanded services that we're considering, if they're still in the review stage, that we're considering expanding: oncology, urology, and then if you were at the town hall several months ago, we talked about the expansion, not the expansion necessarily of the dental clinic, but adding a third dentist for those who are entitled to VA dental care. In addition to that, we are looking at the possibility of adding a 9th primary care team. Right now we have 8 primary care teams here in Lubbock, and they are, I can tell you, they are all about chock-a-block full. So if, right now you're waiting 20 plus days for an appointment, adding a 9th PACT team will significantly reduce your wait time. So that I view is very good news for all of us in this audience. Also, something that we've been struggling with for a number of years is up on the slide it says operating rooms. Well, they're not. We have 4 procedure rooms. They're upstairs here. Some of you may have had some podiatry procedures or perhaps ophthalmology procedures performed here at the clinic. That's about the extent of what we can offer right now because it has to do with the HVAC system that's in those 4 spaces. Hopefully we'll get word next month on a way ahead for those spaces, and we'll be able to convert those into full-fledged operating rooms. And that will allow us to perform a whole host of operating room procedures in those spaces. I'd like to tell you when that will be finalized, but if I gave you a date, it would be a complete swag. It's probably going to be, I would imagine, towards the end of next fiscal year before those operating rooms are converted. Another thing that we're very excited about, we started offering on the 1st of December. Way back here, we've got the urgent care clinic that I'm sure some of y'all have taken advantage of. We've seen great success with the urgent care clinic. To date, we've had over 1,500 veterans utilize the service that we offer. And you can see on the slide, the hours are 8 to 15:30. We're looking at the possible expansion of services, but of course, money's associated with that. There's a whole host of other services that have to be provided to expand those services, but it's something that we are considering. If you've got questions about the urgent care clinic, you can dial the number that's on the screen. I believe the extension is 2420. That'll get you right to urgent care. Okay? And the other one thing I have to highlight, we are going to move, because of space limitation where we currently are, we are going to move the urgent care clinic. That's probably going to happen over about the next month, maybe 6 weeks. So instead of being over there, it's going to be located somewhere else in the clinic where the flow is going to be much better, much improved. So that'll happen again over the next 4 to 6 weeks. I've got a couple slides here that have phone numbers on them. The first one is the VA Health Connect. It gets you in touch with a nurse 24/7. So all you have to do is call that number, and you will receive a nurse on the other end if you're experiencing problems. She or he can tell you to go to the emergency room. You can wait until Monday. She'll walk through the symptoms with you and provide you details on how to seek treatment. So I'm going through these two slides fairly quickly, and the reason why I am is because, Dennis, where are you? Okay, so we've got handouts over here with all these numbers on these two slides. So you can pick one up. If you haven't already, you can pick one up on the way out. So that concludes the presentation portion of tonight. Again, the primary purpose of coming together is to hear from y'all, the veteran, on how we can improve the quality health care that we deliver.
What we've done is we've actually gone and done an individual review for all cases. So every single case that's coming in, everybody that's coming in asking for new services, every single case is getting an individual review to make sure the care has been proper, to make sure the results have been good, and that way if it needs to go to more care, if it needs to go to a different provider, we can actually get you to the right place. So we are actually working on that as we speak. So we do have some prerequisites to get the education in, but we are working on getting you right back out there where you need to be. Notes coming in, if they're not showing that we had progress or that they were working, we're stopping to go back and do a review with the provider to find out what information we actually need to be getting to make sure that you're getting good care. So we want to make sure that the things that we're coming back in are doing the right thing for your actual care there.
And I can say, I mean, I've heard a lot of y'all have issues with what we're doing with chiropractic care right now. Two points in that regard. One is we're trying to bring services back here to VA. Okay, if we don't, in that regard, we don't justify our existence. And the other thing, data studies have shown that care at the VA is you're more satisfied receiving your care at the VA than you are out in town. So in that regard, give us a chance to provide that care for you.
Yes, absolutely makes sense, and we're trying to cut that wait time down for you to make sure, again, that we get you into the thing that's actually going to make the differences there for you. And so, again, I've been personally reviewing all the cases that are coming across to make sure that if we need to get you back out there, we get you back out there. We have another chiropractor that we've recruited to come on board to also help speed this up and cut the times down dramatically. So we are bringing more services in on that aspect as well. And so every message that comes across, every case that comes across comes right in front of my eyes. I'm personally diving into every single one of them and getting the right consults and the right care put right back out as fast as I can for you.
Just, I won't have the specifics on that, sir, but just so everybody understands how when you go out. So, for example, if your primary care provider sends you out for cardiology, the VA has something called a standard episode of care, CR. So in that standard episode of care, it's basically the authorization, and it lists all the CPT codes that the VA has pre-authorized to whatever cardiologist or specialist that you have gone to. And if the doctor in the community does a procedure or test, and it's listed in there, no, we will pay for that. That's that. Now, if it's something outside of that, what your provider, your outside provider, your Tri-West provider, however you want to call it, should be asking us a secondary authorization request, so that we can make sure you don't get charged, sir, for that. So I hate to say it, yes, there is a little bit of responsibility on the part of the patient just to make sure, hey, is this part of my authorization? Now, there is a number, I don't have it with me, but there's a number you can call in our community care. We'll get that. I'm not sure if it's on the sheet there, but there's a number there that you can call, which will contact you with our community care department, which will look at what your authorization was. So you can actually ask beforehand. So if you're a cardiologist, where did we see that? Okay, here it is. It's 806-468-1805, 806-468-1805. You guys can pick up one of these. And they can answer the question before you even get referred to the other specialists. Just to make sure we do get your authorization taken care of, because we don't want you to get charged. Absolutely, that's our goal.
Okay, so within each PACT, we have our core PACT team, which is the primary care provider, the RN, the LVN, and the clerk. So that is the core PACT team. Like Mr. Lucas said earlier, we have 8 core PACT teams. In addition to the core PACT teams, we also have the services that we call extended PACT services. These are the nutritionist, primary care mental health integration, the physical therapist, basically all the other services are part of PACT. I believe the one service that you're talking about is our PACT pharmacists. And yes, we still have PACT pharmacists here. They still work with each team. If at one point and this is me just doing a supposition because I don't know your exact medical care, if at one point your diabetes was deemed under control, appropriate to be managed, you would be released back to your primary care, your core PACT team. But if during this transition, during the time, months, years since you were with the PACT pharmacist, you're experiencing difficulty controlling your diabetes, you're realizing that your A1C is elevating, or when you're doing your blood glucose checks, you're finding that those are elevated, then absolutely you can get back to the PACT pharmacist who focuses on diabetes.